How to choose dental paste for child? At the shelves with toothpastes, you do not often see children. Brushing your teeth doesn't really affect babies. But young mothers carefully read the labels on the labels in order to understand what components are contained in milk care products. Would they harm their child? Anyway, is it so important to apply the paste from the first tooth? From which age to use dental paste? Milk teeth usually erupt completely by 2 to 2.5 years. Up to this age, buying pasta is not recommended. Let the child at least learn to rinse his mouth, and you will be calmer. Up to this age, it is enough to brush your teeth with brushes. From 6 months, silicone. From 12 months, soft children. And do it carefully twice a day. Which paste to choose? The first choice must be made in favor of a gel-like paste. It does not contain abrasive substances and, accordingly, does not injure immature enamel. After 6 years, it is permissible to use funds for adolescents. But adult pastes, and especially whitening ones, should not be used. They contain substances, mainly calcium carbonate and sodium bicarbonate, that can quickly destroy enamel of milk teeth. To understand that the paste did not fit the child is quite simple. If plaque constantly forms on the teeth, provided that the baby has no problems with the gastrointestinal tract, change the manufacturer. Learning labels golden rule: the fewer components are listed on the package, the better. And ideally, they should all be familiar to you. But since there are few experts in this matter, we'll try to deal with the main pests. Firstly, there should be no carcinogens and preservatives: sodium lauryl sulfate, sodium benzoate, benzyl alcohol, any parabens. You can recognize their presence by looking at the expiration date of the toothpaste. If more than 12 months, it is better to refuse it. Often antiseptics are added to the paste: triclosan, metronidazole, chlorhexidine. But remember that, in addition to harmful bacteria, they kill the natural microflora of the oral cavity. Various tasty additives should be natural: eucalyptus, vanilla, mint, anise. Better, the most tasteless or at least not sugary sweet pasta. After all, sugar, sorbitol, glucose, sucrose contributes to the development of caries. The presence of special components, for example, for the gums, in children's toothpaste is completely unnecessary, because to achieve the effect you need to try to brush your teeth for at least 5 minutes. As thickeners should be natural ingredients, plant pectins, for example, derivatives of algae, or xanthan gum, food supplement. As for the useful components, these are lactoperoxidase and lactoferrin, milk enzymes, lysozyme, immunostrengthening, casein, accumulates calcium in enamel. Remember that a good paste should contain as many minerals as possible, such as calcium, fluorides, aminophosphates. These substances are necessary for the proper formation of enamel. Is fluorine harmful? Fluoride is not safe to swallow, so it should not be in pastes for the smallest. But from 2 to 3 years it is quite acceptable, but in a small amount, up to 0.023%. It is especially recommended to use such pastes for children who regularly have caries. However, if your region has an increased fluoride content in drinking water, then it is better to refuse such pastes in order to avoid tooth fluorosis, a disease that leads to thinning of tooth enamel. The first signs are white or yellow spots on the surface of the teeth. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Don't forget to check some useful links in the video description below. Hope see you back on Lify Life.